A very good morning, students. And one of the Dr. Shiksha, her name is. So the doctor has asked me, sir, I just got an MCQ in previous Inicet 2019. Can you discuss the MCQ, sir? Sure. She has posted on in my account. So just the MCQ is, she said, a mother came to the OPD with symptoms of depression, she said, and she had a normal delivery 3 weeks back. Okay, so the mother had a history of normal delivery 3 weeks back, right? So she is a postnatal mother, fine, and feels depressed. So the mother is telling all the symptoms to the doctor, all the symptoms of depression, regarding depression, to the doctor, and she says she is having depression for the past few days. She feels depressed for the past few days. Now, which drug should be avoided from the following options for the treatment? See, the examiner did not ask you what is the drug of choice in this condition. The examiner is asking which drug should be avoided. Now, these type of MCQs are the fan favorite of Inicet professors. They love always asking the avoiding or the drugs which are contraindicated, which have the most side effects, which drug should not be kept in that condition. So these are all our fan favorites of Inicet patterns. So now tell me, which drug should be avoided in all the 4 of these drugs? Is it sertraline? No, it's not sertraline. Why? This is the SSRI of choice in this condition. This is the SSRI of choice in this condition. So it's not sertraline. Is it brenolone? Is it brenolone? Of course, it is not brenolone. Even why? It is the drug that can be used in postpartum depression, something which is related to the question. So that implies it is not brenolone. Is it all the above? Is it all of the above? No. This can be used. This can be used. Then how all of the above can be the option? So it is not even all of the above. Now what option is remaining now? Paroxetine. So the answer is paroxetine. Paroxetine is the answer. It's as simple as like that. What is the answer? It is paroxetine. Paroxetine is the answer. Now we will discuss about postpartum mental illness. We will discuss the topic, right? We will discuss the topic postpartum mental illness. Very important topic, guys, and it is one of the fan favorite of Inicet. Inicet AIMS professors love these type of topics because it is the most common conditions that they see in their OPD. So obviously they love these topics, right? Now, what is a postpartum mental illness, right? It is most common. It's actually seen in the postpartum period. It's actually seen in the postpartum period. But what is the duration? If you ask me the duration, according to ICD, the duration is 6 weeks. According to ICD, the duration of the condition is 6 weeks. 6 weeks means what? 6 weeks means 6 weeks following the delivery. 6 means following the 6 weeks following the delivery. The condition, the duration of the condition is 6 weeks following the delivery. But if it is DSM, regarding DSM, if they ask, it is 4 weeks following the delivery. 4 weeks following delivery. Okay. Now, what are some different types of postpartum mental illness? First one is postpartum blues. Very important topic. Please concentrate. Next one is postpartum psychosis. Postpartum psychosis. And finally, postpartum depression. This is the most common thing that we see in mothers: postpartum blues, postpartum psychosis, postpartum depression. Now if you ask me the onset, what is the onset of postpartum blues? It is within 2 to 3 days and resolves when the duration, or it resolves within 2 weeks. Postpartum blues onset, they occur within 2 to 3 days of the completion of delivery, after delivery, and they resolve within 2 weeks. If it is postpartum psychosis, they start around 2 weeks after delivery. Now PPD starts around 2 to 4 weeks after delivery. PPD symptoms are observed around 2 to 4 weeks after delivery. Now if you ask me what is the incidence of each of these condition, it is very simple. The postpartum blues occur in 50% of the individuals, and postpartum psychosis occur in 0.1% of the individuals, and postpartum depression occurs in 5 to 15%. It's as simple as like that. Postpartum blues occur in 50%, postpartum psychosis occur in 0.1%, and postpartum depression is seen in 5 to 15% of the individual. So always remember postpartum blues because it has the highest incidence. 50% of the women have postpartum blues, right? Now if you ask me some of the remarks regarding, or some of the conditions that you see in those 3 things are: first one is the postpartum blues can be benign sometimes, or it can be self-limiting also. Just one minute. It can be self-limiting also, right? So it can be a benign or it can be self-limiting also. But if it in case of postpartum psychosis, it is abrupt. The condition seen here is abrupt, and the patient might appear like acting out. Right? Now in case of postpartum depression, there is always symptoms of depression. Remember, there is always a symptoms of depression. It's always symptoms of depression. It's as simple as like that. Okay. Now we will discuss the treatment of this postpartum mental illness. We use SSRIs, and the SSRI of choice is sertraline. Remember, it is sertraline. Okay. Now what are the SSRIs that should be avoided? Now this is important. SSRIs that should be avoided. What are those? Can anyone tell? First one is fluoxetine. Second one is paroxetine. Right? Now I asked one more thing, that is, I said one more drug, that is, sorry, it's actually the name I just misrepresented. It is brexanolone. Actually this drug is specific for postpartum depression. This drug is specific for postpartum depression. And this brexanolone, it can be given via IV infusion over 60 hours. Remember this is an important statement. Brexanolone can be given as a IV infusion for 60 hours, and it's also specific for this, a specific drug for postpartum depression, brexanolone. Okay, till then, you understood? Yes, we'll meet in the next topic.